Google believes that technology can make the world a better place, and so do we. In fact, we're involved in a project that's demonstrating how technology is making lives better in one of the most vulnerable areas in the world, the Masai Mara in southern Kenya. Narok County is home to 900,000 people, many of them nomadic Maasai. In 2014, there were approximately 260 nurses, 48 doctors, and 75 clinical officers to meet the healthcare needs of this population. There are clinics scattered throughout this rural area, but it can still mean walking 4 or 5 hours just to get to the clinics, and then possibly traveling another 4 or 5 hours on bad roads by car, motorcycle, or ambulance to another facility where there's a possibility of a doctor and a higher level of care. The clinical officers and nurses who staff these remote clinics are responsible for providing their communities with all types of medical care, including, but not limited to, treating patients, immunization, pre- and postnatal care, deliveries, HIV counseling, minor surgery, stabilizing patients before they can be transported by ambulance, and patient education on a wide variety of topics. It's a tough job. The isolation, the lack of resources, both medical and professional, the long hours, and the challenge of treating some of the most devastating diseases where there's little or no internet connection. It can overwhelm even a seasoned professional. Research tells us that there are many reasons why it's hard to retain healthcare workers in rural areas, but one of the main reasons they tend to leave is lack of resources and lack of access to professional development. A Better World has been providing support to healthcare facilities for the last 15 to 20 years. 3 years ago, healthcare workers asked for help in obtaining resources that aid them in dealing with some of these challenges. So we responded to this request by first loading mobile phones for 6 workers with a library of apps and information. We also helped the healthcare workers set up a group site on WhatsApp, where they could collaborate on problems that they were facing. With input from our original 6, we came up with Phase 2, selling tablets instead of phones to an expanded group. Over the next 2 years, we brought tablets to Kenya, loaded with videos, ebooks, medical apps, and a variety of other tools. The healthcare workers came with money in hand, sight unseen. They knew these tablets would be beneficial. There are now 60 healthcare workers using these tablets, and feedback from those using them tell us that the tablets have been instrumental in helping them take control of their jobs and in helping their patients take control of their own lives, influencing the lives of generations to come. They've expressed that they feel they're a better practitioner because they have the tablets. These tablets have proven effective, but they're not without their limitations. We recognized that we needed to do more, but couldn't find a tool that would meet our needs. So, our team is ready to take this unique project to the next level. While the tablet has been a game changer for those who've been using them, there are many things we'd like to do that'll make these tablets the center of a community of practice for healthcare workers in rural Kenya and Tanzania. The new tablet will allow participants to connect, communicate and share information, stories, and experiences that'll help to build understanding and insight, allow for dialogue that will help solve problems, provide learning opportunities both for and by the community, allow for collaborations that'll encourage the free flow of ideas and the exchange of information, and create and share resources that are current and evidence-based that can be used to improve the lives of their patients. So what is the next phase? We want to upgrade the tablets to ones with SIM capability, thus allowing the healthcare workers to collaborate with others via 3G network and allow for constant updating of information. Increase the number of tablets to 2,400. Introduce the tablet to rural healthcare workers in Tanzania. Provide train-the-trainer sessions so healthcare workers can provide training to new community members. Make all files searchable. And train community members in content creation, in particular, creating patient education videos. There are many amazing apps out there, like the Digital African Health Library, that was developed for the realities of healthcare in Africa. In fact, there's more than 165,000 medical apps, and the number is increasing daily. But we haven't developed a new app. In fact, we haven't developed any new technology. One of the things we are doing is helping to filter and organize information. Even if they are able to travel to a center to access the internet, and even if they have a decent phone or tablet, it is overwhelming to sort through apps and internet articles. Most North Americans share this frustration. Our team of content advisors will sort information and provide them with the most up-to-date, evidence-based resources. When they purchase their tablet, they receive current hardware with the best resources already downloaded, removing the need to sort through the sometimes overwhelming web and allowing the tablet to be fully functional without the web. The best thing about the tablet will be that it will empower the clinical officer or nurse who uses it. They'll have the confidence to continue working in isolated areas and will know that they are never truly alone. Reducing this sense of isolation will aid in retention and ultimately lead to improved healthcare. We are combining apps, libraries of information, functions like the camera, training, and a whole world of connectivity. Owners of the tablet will become both students and teachers, mentors and collaborators, and members of a professional learning community. And it doesn't have to stop there. So who are we? We are a team of people. Clinical officers and nurses in remote rural clinics working in Narok County, Kenya, who are piloting and evaluating the tablets. And Canadians from A Better World Canada, an NGO with 26 years of experience providing assistance with education, clean water, and healthcare in developing countries. Our project team includes medical content advisors, educators, software specialists, information managers, entrepreneurs, and business managers. But we'd like to expand our team by inviting Google, the Kenyan and Tanzanian Ministries of Health, and other content providers to partner with us. So why should you choose us? Well, we believe we are already having an impact. Those who are using the tablets tell us it's making a huge difference in their practice. We know that lack of access to professional development for rural healthcare workers is a big problem, and we know that this model helps to fill that gap. So by increasing the functionality of the tablet, we'll be making further strides in reducing the isolation of healthcare workers. So, impact. Check. We believe that we're using technology in an innovative way. The problem isn't that the technology hasn't been developed. It's that it hasn't been accessible to those working in remote areas. We're making all those great tools accessible through the tablet so that healthcare workers can do what they do best, providing great healthcare to their communities. So, technology. Check. The challenges of accessing information and resources in remote areas is a universal problem. So this tablet could be used as a model for building other communities of practice in Kenya and Tanzania in education or agriculture or entrepreneurship. Or it can be used to expand this medical community of practice to others in rural Africa or rural India or rural the world. So it is scalable. You bet. Check. We've been developing this project for 3 years now. We know it works. We know that it's impacting the lives of healthcare workers and the people in their communities. We know that the healthcare workers are willing to spend up to 50% of 1 month's salary to access this technology. With Google's help, the connectivity will be feasible. We already know that the concept works. So is it feasible? Absolutely. Check. The proof is in the pudding.